Welcome everyone to Type 2 Diabetes Jeopardy! Before we jump into the game, here's a quick overview of the disorder we'll be exploring today. Type 2 diabetes mellitus is a chronic metabolic disorder where the body becomes resistant to insulin, and over time, the pancreas cannot keep up with increased demand. This leads to elevated blood glucose levels that affect the whole body. Common clinical manifestations include increased thirst, frequent urination, fatigue, blurred vision, slow wound healing, and sometimes numbness or tingling in the hands and feet due to nerve damage. Uncontrolled diabetes can impact multiple organ systems. It can damage the kidneys, eyes, heart, blood vessels, and peripheral nerves, raising the risk for complications like kidney disease, heart attacks, vision loss, and diabetic foot ulcers. When caring for a patient with type 2 diabetes, several head-to-toe assessments become especially important. Nurses should closely assess blood glucose levels, inspect the feet for ulcers or decreased sensation, evaluate peripheral pulses, monitor blood pressure, and assess vision and overall neurological function. These assessments help us catch complications early and keep patients safe. Now that we've covered the basics, let's get ready to play Type 2 Diabetes Jeopardy!
Okay.
Here are our contestants. We're going to start with Chelsea.
Okay, can I do organ impact for 100?
Organ impact for 100. Okay. Prolonged high blood sugar can damage this organ's filtering units, leading to chronic kidney disease. Okay.
What is kidneys?
Yes, correct. Good job. 100 points to Miss Angie. Angie, it's your turn to choose from the board.
Patho for 100.
Okay. This resistance causes the body to need more and more insulin just to maintain normal blood sugar levels. Chelsea with the steal.
What is insulin? Resistance? Oh,
Correct. Okay, Chelsea, you're in control of the
let's
board.
do organ impact for 200.
Organ impact for 200. Damage to the small vessels in the eyes may result in blindness. Yes, Angie?
What is blurred vision?
Diabetic retinopathy.
Sorry.
Okay. Let's do clinical manifestations for 100.
Okay. These 3 hallmark symptoms often appear when blood sugar is uncontrolled. Chelsea?
Polyphagia, polyuria, and three P's, I don't know what the third P is. Polyphagia, polyuria, and polydyspia. Oh, that was close.
Nice job, Chelsea. Angie, you get to be in control of the board. What would you like?
Clinical manifestations for 300.
Okay. Patients may report this type of nerve pain described as burning, tingling, or numbness. Yes?
What is diabetic neuropathy?
We'll give it to you anyway. Okay. And Angie, what would you like to choose?
Clinical manifestations for 400.
Okay. This vision change can occur due to fluctuating glucose levels pulling fluid from the lens. Angie.
What is blurred vision?
There it is. All right, Angie, you're in control of the board still. What would you like to choose?
Head to toe assessment for 100.
Okay. This simple vascular check in the feet is essential due to poor circulation. Yes, Chelsea.
I love my phone. Isn't it just your foot check? But I don't know what that's called.
Would you like to steal?
Yes. What are pedal pulses?
Yes. Okay, Angie?
Head to toe assessment for 200.
Got it. The nurse should inspect this area for ulcers, redness, calluses, or deformities.
Beep.
Yes?
What are the feet?
Good job. All right, Chelsea steals the board. What would you like?
Let's do. Where are organ impact for 300?
Okay. Diabetes significantly increases the risk for this major cardiovascular event.
Beep.
Yes.
What is myocardial infarction?
Correct. Nice job. And you're still in control of the board. What would you like?
Let's do organ impact for 300 or 400. Sorry.
And you got it. Poor sensation and decreased blood flow to this system increases risk for ulcers and amputations. Angie with the steal.
What is the peripheral vascular system?
Yes.
Nice.
Nice job. All right, Angie, you have the board.
Head to toe assessment for 300.
We did this one. Numbness, tingling, or burning sensations are symptoms the nurse evaluates in this system. Yes.
The neurological assessment.
Yes.
Jeopardy, it's your game.
Okay.
Head to toe assessment for 400.
Okay. This vital sign trend is important because of the increased risk for the hypertension and heart disease. Angie?
What is blood pressure?
What is blood pressure? Nice job.
Which one's head to toe assessment's done. Let's do patho for 200.
Okay. This organ initially produces more insulin to compensate for resistance, but eventually burns out.
Beep.
Yes.
What is the pancreas?
What is the pancreas? Beta cell dysfunction. Nice job. Okay, Chelsea?
Pathophysiology for 400.
This hormone imbalance is type 2 diabetes mellitus, causes increased hepatic glucose release even when the person isn't eating. Angie.
What is glucagon?
Oh, I did know that.
Good job.
Wait, what do we have left?
Pathophysiology for 300.
Oh.
Describe type 2 diabetes in one sentence. Yes.
It's insulin resistance. Something.
What is a chronic metabolic disorder characterized by insulin resistance and progressive beta cell dysfunction leading to hyperglycemia? Nice job.
Okay. Thank God. Okay, is that all of them? We have Final Jeopardy.
Okay. Patients may report this type of nerve pain. You guys got that one. Nice job. Okay. Now we're into the Final Jeopardy. Provide 3 essential assessment priorities and explain why they matter for a patient with type 2 diabetes mellitus.
Feet assessment to check for any wounds. Neuro assessment to check for any loss of sensation, any tingling or numbness. And
10 seconds, otherwise Chelsea has a chance to steal.
like a skin say pedal pulses, but I don't know.
Okay.
Okay. With the steal.
What is the last one? Blood glucose monitoring. To watch for your
We
blood
have the
glucose.
food assessment to detect ulcers early because neuropathy prevents the patient from noticing injury. Blood glucose monitoring to evaluate control and determine risk for acute complications, and neurological checks to assess for peripheral neuropathy that increases fall and injury risk. Nice job, ladies.
I think Angie won.
And that will complete this game of Jeopardy!
Thank you.